Thanks for joining us today. My name is Samantha, and I'm an obstetrician and gynecologist working at KK Hospital. So today I'll be talking about fibroids, what they are, and the medical management options. So the outline of my talk will be as such. We'll start off with an introduction on fibroids, a brief background on fibroids, their symptoms, as well as potential complications. And then we'll talk about the non-surgical treatment options, including surveillance, non-hormonal as well as hormonal therapies, and finally, alternative medications. So all these can come together to provide individualized treatment, which is best for your particular situation. So first and foremost, what are fibroids? Fibroids are non-cancerous growths in or around the womb. They are comprised of muscle as well as fibrous tissue. What do fibroids look like? So some fibroids can be so small that they are not noticeable at all, whereas other fibroids can mimic a pregnant belly. During surgery, fibroids can look like red, round balls of flesh, and they are typically easily separable from the womb cavity by a capsule. The size of fibroids can vary greatly. Some can be as small as 50-cent coins, and others can grow to 10 to 20 cm in dimension. Fibroids are very common. Up to 70 to 80% of women will have fibroids by the time they hit 50. Fibroids are most common between 30 to 40 years. Unfortunately, the exact cause of fibroids is unknown. However, we do know that certain things increase the risk of getting fibroids, and these would include being aged 30 to 40, obesity, never being pregnant before, a family history of fibroids, and ethnicity, particularly being African American. Symptoms of fibroids most commonly reported include heaviness and pain. Other patients might sometimes complain of problems with passing urine and or motion, especially if the fibroids are large. Fibroids can also cause menstrual disturbances, including cramps, heavy bleeding, leading to anemia. Other complications of fibroids include difficulty getting pregnant, as well as pregnancy-associated risks. So how do fibroids affect fertility? Fibroids can distort the womb cavity and block the fallopian tubes. This in turn impairs the transport and implantation of embryos. Surgical removal, known as a myomectomy, may be recommended when fibroids indent the womb cavity in patients who are trying to conceive. So this is an example of a submucosal fibroid which is indenting the cavity of the womb as seen on hysteroscopic imaging. How do fibroids affect pregnancy? Fibroids can lead to pain during pregnancy during degeneration, and they can also increase the risk of miscarriage, cesarean section, early labor, abnormal presentation of the baby, and bleeding after delivery. So many people worry about whether fibroids can be cancerous. The short answer to that is that they can be, but they rarely are. So we recommend that you see a gynecologist early if you have abnormal bleeding, especially postmenopausal bleeding associated with vaginal discharge, pelvic pain or mass, and rapid growth in the size of your fibroid. Individualized treatment for fibroids should take into consideration fibroid factors as well as patient factors. Fibroid factors will include the size and location of your fibroids, as well as whether they have any worrisome features. Patient factors would include symptoms, the desire for fertility, and the impact on your quality of life. Surveillance is recommended for patients who have small and asymptomatic fibroids with no suspicious features on imaging. Typically, the interval of follow-up should be individualized between visits for each patient. Symptomatic measures, including hot water packs, can sometimes be helpful for alleviating mild symptoms of fibroids. For other patients, painkillers might be helpful in relieving pain. Painkillers could include paracetamol, non-steroidal anti-inflammatory drugs, otherwise known as NSAIDs, and opioids. So any of these painkillers can be used by themselves or in combination with other forms of therapy. Tranexamic acid, otherwise known as TXA, is part of a class of drugs known as antifibrinolytics, and they reduce menstrual bleeding by slowing the breakdown of blood clots. Hormonal therapies which can be used include combined oral contraceptive pills, more commonly known as birth control pills, oral progestins, injectable progestins, implants, and intrauterine devices such as the Mirena. So a little bit more about the Mirena. The Mirena is a T-shaped device which is inserted into the womb, and it can last for about 5 years. It releases progesterone, which eventually thins the womb lining and therefore results in a reduction in menstrual bleeding. GnRH is short form for gonadotropin releasing hormone. It primarily blocks estrogen production, which then leads to shrinkage of fibroids and sometimes stops bleeding. It, however, is associated with menopausal side effects and is therefore not intended for long-term use. Alternative medications which have been used in the past include something known as Asmaya. Asmaya was used as an alternative to surgery because it could shrink the fibroid size and reduce uterine bleeding. However, it was recently recalled due to adverse drug reactions, including serious liver injury requiring transplant. Therefore, it is no longer available on the market today. So individualized treatment should really consider what are the things which are important to you and what are the symptoms which are most bothersome to you. You can discuss with your gynecologist to come up with a method of treatment, and bear in mind that all the treatments which we discussed earlier are part of non-surgical treatments and are really just one aspect of the treatment of fibroids. So finally, this photo reminds me of how rewarding it is when patients with fibroids are successfully treated and go on to deliver healthy babies. I will be happy to address any of the questions you might have later on during the interactive session of our webinar, and I thank you very much for your time today.